Sometimes, there's many dose corrections that need to happen, but, we're in the world of modern TRT, many factors that testosterone helps with our mental health, and we see this with many patients.
Yeah, trying to just optimize things at the same time. So if you go on TRT and
That's a tricky part about testosterone, because a lot of people will say that, oh, I've got the best protocol.
energy just seems to go just up and up, and then it's hard thing to measure. I mean, now you can even measure your mitochondrial health just in daily life.
It helps, but it doesn't always, or there's that transition as some patients when they first start. All right, so one of the things as we age, we're talking about is having enough energy, okay, and to kind of get the things done that we want to do, to take care of our families, to be with our partners. I mean, what are your thoughts on what TRT did for you and energy levels?
100%, yeah, it's increased my energy levels. I mean, it's this kind of synergy, I guess, with, say, if you're optimizing your insulin sensitivity, and then there's a massive link with that and mitochondrial function. So yeah, trying to just optimize things at the same time. So if you go on TRT and then you improve your diet, your fasting glucose, all these things start to improve, then energy just seems to go just up and up. And then it's hard thing to measure. I mean, now you can even measure your mitochondrial health just in daily life. Just little things just become things I've noticed. Say, like if I'm at the supermarket and the one I go to, often the lift is always broken and it's like multiple flights of stairs, and I've got bags of heavy shopping. And then I think, oh, God, a couple of years ago, when I get to the top flight of the stairs, I would be feeling it in my legs and everything, and just feeling a little bit of, shortness of breath, very slight. But now it's just literally just feels like nothing. Effort just feels good.
Yeah,
difference.
That's I like that saying. Testosterone makes effort feel good.
Yeah, I think Andrew Huberman came around, didn't he? Yeah.
No, it is true, and in many ways, we can't forget some of the benefits that testosterone has on our mental health. And in particular, testosterone can boost your dopamine and potentially serotonin downstream. There are many factors that testosterone helps with our mental health, and we see this with many patients. Does it always fix it if there's an underlying issue, some other issues? It helps, but it doesn't always, or there's that transition that some patients, when they first start, some patients feel brilliant on it, and there are other patients that might be more riddled with anxiety, and sometimes
about as an average, it'd be more leaning
more people don't than others. There's a few very sensitive people to testosterone. I think given enough time, it does go away. Sometimes there's many dose corrections that need to happen, but we're in the world of modern TRT, where especially at BMH, it's not a one size fits all. Everyone has a slightly different protocol based on their individual bodies and biology, but there's always a starting point for whatever you do. And sometimes that starting point needs to be adjusted, and the patients need to give enough time to allow for those adjustments to occur. And sometimes when too many things get changed, or too many things get changed at once, who's to say that down the road, if you just stuck it out, that you would have been better. And if you do change something, you can't just blame or just say associate that change with getting better. And that's a tricky part about testosterone, because a lot of people will say that, oh, I've got the best protocol. So some doctor clinics will offer this protocol, or the marketing thing, really, because if you have enough patients, we always say the best protocol is the one that's going to work for that individual patient. And with enough time, your body does get used to the different signals. Now the question is, how can we make you as comfortable as possible and getting all the benefits, as soon as possible? And that's what we kind of strive for with TRT. But a lot of patients don't realize that, that it does take some adjustment. Sometimes you hit it straight away, boom, but you really can't predict it. And that's found in, you were talking about that level 15 nanomoles per liter, right? Yeah. There's that paper that came out from the Aging Male Society, and they say there isn't a particular testosterone level that one would predict when you should go on treatment, and a testosterone level of when you'll get benefits of testosterone treatment. So there is no international consensus on that.
I can imagine. And then, because it's about, I guess, having a bar marker of when you were, say, 20 or 25 even, and then you find out you're 15, you're like, well, what was I 10 years ago? Oh, I was at 35. Okay, now I'm at 15. There's a big difference.
There's a big
there. No wonder I
difference.
feel bad.
If you're always about 17 or 18 and you drop to 15, okay, you're probably not going to notice it.
Nothing to notice, yeah.
And that's where, again, we go back to the ranges. They're not really fit for purpose. They're not least fit to be looked at as saying, I'm either underdosed or overdosed, because, we have to look at that individual. We have to look at different parts and peel it back. And then that's important for the treatment, but that's also important that once you get steady and stable with that, you're going to be good. And have you heard this? Everyone says, I want to be stable. I want to have stable levels across the board. Yeah, you kind of hear this in the TRT world now. I don't know. We know that your own body, when it produces testosterone, it's not stable, is it, Tony? Right? Your levels go high in the morning, drops down in the evening.
Varies, isn't it? About what, 20%?
Yeah, so there's some variance. So I don't know. I wouldn't call that stable, and maybe the body's not meant to work. I think what people are saying, they want to feel stable up here. They want to feel stable in their mood. And there can be sometimes, and this is life, even when your own body's making testosterone, you don't always feel stable. Did you feel stable before you started TRT? Well before you knew you had an issue, right? You had some good days, you had some bad days. Not every day was perfect. And when people start the treatment, the expectation to be stable, and this is pushed by some clinics and some people, and then it just kind of gets repeated in the community. And I'm the guy that's been saying, well, hang on a minute. I'm tired of this mantra because it's not completely accurate. I kind of understand where people are coming from. We all want to just be able to go day in and day out, feel great. I don't think that's the reality of life. And there's some days you're going to be up, some days you're going to be down, even with the best protocol. And so some protocols, you try to mimic the natural diurnal rhythm. Creams are very good at doing that. I always thought daily injections of testosterone propionate is very good for doing that, but you can also do every other day. I've been on every 3 days. I think you're using the testosterone cream. Daily or twice daily? Twice daily. Twice daily. You get nice rhythm. So, and a nice level. Do you want to share what your testosterone levels were?
They fluctuate a bit. I think that's a drawback with cream, is trying to get a stable reading, because I think there's crossover from maybe my boxer shorts, maybe, I don't know, but it's kind of varied from around 27 up to, I think, maybe like the 40 mark nanomoles. So
it depends on the time when you test it after.
Yeah, it's been exactly the same, 12 hours. But just the variance, I think it's just maybe on my skin, maybe it's taken a bit longer to absorb through. Whether it could be from my boxer shorts, I don't know. But
you should give it time to dry, but even not. But overall, you feel good.
Yeah, and obviously all my other biomarker, hemoglobin, perfect.
They're perfect.
So HDL, I keep a close eye on too, making sure that doesn't.
So a couple of things that everyone should remember when it comes to testing for testosterone. One, it uses radio immunoassay, and not LC mass spec, but even LC mass spec, there's some variation. If you even ran the same sample twice, you're going to get a slightly different result. Okay, so that can be just a variation in the sample. You're not always going to bang on the same thing. You get close, but not the same thing. So that can happen. Two, there are variations in absorption. You're right. Humidity that day when you applied, how dry your scrotum was. Were you even applying it to your scrotum, or were you applying it to?
Yeah, scrotum.
Okay, because not everyone applies to the scrotum, but that is their preferred. So there are different areas of your body where you apply. There's different, even when you apply to the scrotum, different conditions. Maybe you shaved a few days earlier or that day and applied. Do you shave every day your scrotum?
Or about once a week, and now probably even 2 weeks now. I'm just so busy.
Right. So there are times when you may not have shaved, and the days that you did shave, you're going to get a better absorption, and it's going to last longer. Maybe it's the way your body metabolizes that cream over time. So there's so many, but the point is your androgen receptors are saturated. Right? They're doing something. They've been switched on. And those few hours when you go to get that blood test, and if they're not quite there, it's okay, because it's a fluctuation. It's a fluctuation. And it's not like when you're naturally on your own and having those low levels, and then you're always at those low levels. It's, I guess my point is, stability mantra isn't what it's cracked up to be. Know that we all want to be feeling great every single day. And if you want to call that stability, fine, let's call that stability, but let's not pretend that the pharmacokinetics of these different treatment modalities of testosterone, that stability is actually the best option across the board.
Other extremes of the spectrum, where people in the past doing a shot every 10 days, or even
yes, actually, that's a good point, Tony. That I would agree. That is not stable, and I've so many times heard from the old school doctors that it's quite a binary thing with them, where it's either you do injections, and you get that injection every 2 or 3 weeks, or you do creams that you do daily. And there's no in between. Or the assumption is if you're going to do injections, then they have to be these long-lasting injections. And we're saying, throughout the modern TRT world, we're saying, well, no, you can do smaller, more frequent injections, and it's going to change the pharmacokinetics a bit. Everything goes up and goes down, but you're trying to catch the low point, before you reapply again, but you don't want to drop it so low, like the 2 to 3 week injection mark isn't ideal. I mean, let's look at Undecanoate, Nebido, for instance. It's and I've said this before, it's not magic. If you whack in 1,000 milligrams of a slow burning ester, like and testosterone Undecanoate, it's no surprise it may last, at least on paper and in some clinical studies, up to 12 weeks. In reality, patients are lucky if they don't need another injection in 8 weeks. So again, there've been other times when people have looked at that Undecanoate molecule and just injected weekly, and they've been absolutely fine because the dose wasn't 1,000 milligrams. They lowered it to 100 or 200 milligrams, right? So it's the amount that you're injecting across time to be able to get these levels, kind of a steady state level of you fixing the symptoms, really. And if that means some people want to do daily or daily application of creams, then so be it, because at the end of the day, it's about trying to improve symptoms, and it takes time.
If you found this video helpful, hit the like button and subscribe for more content on hormones and men and women's health. And until next time, take control of your body and your health.